I'm very fortunate to have known Dato. The funny thing about life is that we were family friends. My parents knew his parents, and they knew each other for a long time. And you'll be surprised that I didn't know this till in 2017. I had a Deepavali function in my house, and my parents were, my parents' house and all that, and Datin and Dato came to the house for the function and meeting. So I introduced my mother and my father to Dato, and my mother says, "Oh, Dato, I remember you as a baby being carried by your mum and brought by your dad, Tan Sri, to the Bukit Batajam house, where my father was the district engineer for northern Malaysia at that time, the railways." And I got a shock. And I said, I didn't know this. I knew they knew each other because we had a small community, but I didn't realize that actually the friendship had gone much more beyond that. So the families knew each other, but I guess because we grew up in different places and everything, I didn't know Dato Jia very well till I met him once when I was working as a medical officer at Ipoh, and he had come up to Ipoh to talk about bronchial asthma, and that was something that he liked very much to talk about, and they had come up to discuss how we should actually treat asthma patients, what were the new methodologies to look at, and how to assess an asthma patient. And I think at that time I was training to be a gynecologist, and it was sometimes very difficult to assess patients who had asthma in pregnancy. We were not sure whether the asthma was making it worse or whether the pregnancy was making it worse. But the fact that they came and they introduced this new equipment, and they were able to treat him and treat the patients, it was good, and it was my first encounter after a long time, after for the first time meeting him and talking to him and all that. Subsequently, we lost touch, and I believe at that time Dato Jaya was working in Klang Hospital, and till I came as a qualified specialist to HKL and was working in the Department of Obstetrics and Gynecology, and there our paths crossed each other. We were keen to start off many services, so we discussed various options. There was a point when I was not feeling very well, and he actually treated me, and there was a point whereby it was very odd, but I think it's quite fair for me to say that some people actually thought that I was having TB. All right, and they actually started me on TB treatment, and I tell you, I was going through hell, and I told him, look, something's not right. And finally he looked at me, and against all the other physicians, he decided to take me off the drugs and give me something different. And then he felt that this was a hospital-acquired infection that actually caused a bit of effusion in my lungs. Now that takes a man of experience to recognize. It is frightening because as a physician, as a doctor, you know that many things can happen, right? And you go back and you read to find out what you may have forgotten as a medical doctor, because I was a gynecologist. I've not read medicine for a long time, but to update myself and see what was I'm going through. And it was really good that when after I recovered and I talked to him about it, and I said, you went against all odds to treat me, because everybody else felt that he actually was doing the wrong thing. But he said one thing which I believe is very true. He said, a good doctor doesn't mean that you actually read your books or that you have actually served 5 years. A good doctor is made up of someone who has served willingly and passionately. And I think that has been his motto. You know, he has been passionate in whatever he's taken up to do. Whether it's treating a patient, whether it's looking after an NGO, whether it's committing himself to ensuring that medical care in the country gets better, whether it's looking at the healthcare in the peripheral districts, anything that you ask him, he has been very passionate about, and he actually goes all the way to see that the thing gets done. And I think that sometimes when you look back and you think is what drove it to achieve where he actually achieved. I still feel that there was a lot more that he could have given this country. And I feel that there was a lot more that we have actually lost because of his knowledge, the diversity in his experience, his aptitude towards diagnosis. He had a third eye. It's sometimes difficult as a physician, and I think only through experience you are able to develop that third eye. And that's what he had. And you could see when he sat in his clinics, it may be the finance minister coming through his door, or it may be someone who was his, his clerk or his gardener who may be standing outside the door. There was no preference. He would see everybody. He would give it its real due. He did not cut short time. He did not cut short his practice. And he actually stood there, and I know he ran his clinics for hours sometimes. And I know lots of patients waited for him. The other thing that I realized was that I sat in the Malaysian Medical Council, and where we actually sat together to investigate doctors, where complaints were brought against doctors, and how he deliberated with us wisely, how he looked at trying to help some of the doctors where they had actually not made any mistakes, and where at times he actually looked at reprimanding some doctors who actually had done the wrong thing. And I that needs a lot from a fellow doctor, because you are in some ways a jury to the doctors whoever will come to you, and it takes a lot to make such decisions. He was able to. Some doctors had actually left service because they felt that they had a complaint against them, and he actually encouraged them and told them, no, don't do that. Come back into service and I will help you. I'll ensure that this is something that you don't have to worry. And there are times it's actually warned the doctors that they've actually done the wrong thing and not to do it. And I felt that because he had the experience, he was actually in the service for many years, he knew the different levels, the different cares, he had mixed with a lot of people. He actually understood the mechanism and the machinery of how the Ministry of Health ran. He was very humble. You could approach him at any time, and he was able to actually discuss any issues within the ministry, whether it came from the field of his expertise or whether it came from a field which was beyond his expertise. What is most reckoning is that he was also able to convince the colleges in Ireland to actually set up a medical college in Penang. He was one of those who was behind that. He was one of those who actually looked at setting up a medical college with the US and getting them to come and do a twinning program in this country, in which we have been able to see many graduates qualify and serve this country very well in this field. So his thoughts, his visions were far, far reached, and we have lost a very, very great man. A man who would have taken us to the next level of care, of healthcare in this country. And I think in many ways, would have uplifted a lot of deficiencies that actually exist in the health ministry, healthcare in this country. I have been very, very close to him. I have got very close to him, and I've known him, and I didn't even know that he was admitted in the hospital when he fell ill, and I would have actually visited him. We were supposed to meet for a medical council meeting on a Thursday evening, and I was looking forward to that meeting. And suddenly I get this message that it was cancelled because Dato is actually on leave, or is cancelled the meeting. So I thought, okay, fine, so we'll meet him immediately. And then on that fateful day at about 6 o'clock in the morning, I get a barrage of SMSs. I'm wondering why is the phone going with so many SMSs coming in one after the other. And I picked up and I looked at the messages, and I thought that I was reading it wrong. So I actually got out of bed and actually went there and looked through the messages, and some of my colleagues, some of my friends, whoever heard something was asking me, do I know that something has happened in Dato' jail? And I was just lost, and I didn't know what to do. And I tried calling a few friends, and they were not sure. Till finally, one of my colleagues, who also knows Dato' Jaya quite well, confirmed that he is no more. I still couldn't believe it. I said, are you sure? He said, yes. I said, I can't believe it. I mean, we spoke, and I don't think so this will happen. He said, no, this is what's happened. And I was driving to work. I got together and I drove early. I actually came to the house. I came here. And Datin will tell you that I was the first person who walked through that door. And when I saw her, I knew things were amiss. I think it has troubled us a lot. For many days, I couldn't accept it. Trying to attend the meeting, the medical council, whereby he's no more chairing the PIC that we sat on, was also a difficult task to do. There were decisions that he had made that we had to carry out. And we miss very much his input, his advice, his expertise, his foresight. And most of all, I think, his vision. He had it all there. He knew what was the best for this country in many ways. And it's very, very difficult to come by somebody else. I've yet to come across anyone who has given this much, done so much, and had the vision to take this country there. He was passionate about this country. He never thought of leaving Malaysia and going to another country, irrespective of what situation he faced. He actually said, and he said, we will do our best to make this a better Malaysia, a better service that we can give our people, a better healthcare that we can give our people, a better way we can uplift the poor and educate the poor and see that we give better care.
Thank you. That's good.